Hysterectomy is a surgical procedure to remove all or part of the uterus. It can be done by different surgical techniques. We can remove the uterus out by vaginal pathway, or we can use the abdominal open surgery for that, or we can do laparoscopic surgery for removal of the uterus. There are two main parts of the uterus. The upper side of the uterus is corpus uteri called. The lower part is called the cervix. If you're planning to undergo a hysterectomy, the surgeon decides which way of hysterectomy you need. It's planned that you are going to have a partial hysterectomy, then the upper part of the uterus is removed where the cervix is kept inside your body. So partial hysterectomy is much better for young women. But even if you have partial hysterectomy, you will have no bleeding after the surgery. The menstrual periods will stop after this kind of surgery, but you will have better sexual activity, no sexual problems if your cervix is kept with partial hysterectomy. Hysterectomy is a major surgery and it can be done in different techniques in different ways. Laparoscopic surgery is one of the ways to remove the uterus. If you're undergoing a laparoscopic surgery for hysterectomy, then the surgeon will do a small cut in your tummy, in your belly button, and then the camera is inserted to the cavity. Afterwards, we just fill the abdomen with some kind of carbon dioxide gas, and afterwards we had some small more incisions on the lower part of your abdomen to put the other instruments inside your body. Laparoscopic hysterectomy is usually performed under general anesthesia. During the surgery, we remove whole of the uterus, and afterwards the surgeon can also remove your fallopian tubes and ovaries. After a hysterectomy, you cannot get pregnant and you will have no longer menstrual periods. As in every surgical procedure, laparoscopic hysterectomy might have some complications. These are not very common, but during the laparoscopic surgery, during hysterectomy, you can have some complications related with general anesthesia. The surgery is done under general anesthesia. And related with the surgery, afterwards you can have some bleeding, not very significant, but vaginal bleeding can occur. Other minor complications, not very common, related with laparoscopic hysterectomy is damage to the other organs in the abdomen. The more common seen damage can be related with the ureters, or the bowel, or the bladder. These are not very common, but this can happen. And after the surgery, you usually don't have too much pain, as this is with closed type of surgery, not open surgery. The pain related with the surgery is very minimal. You can go to your daily activities in like 1 to 2 weeks. You can have a rest at home. In hospital stays like 1 day, you can go to home and after 1 to 2 days. And after 1 week, you can go back working. And this kind of surgery is really patient-friendly. The major drawback of laparoscopic hysterectomy is the loss of fertility. You cannot get pregnant, but during the surgery, if your ovaries are not removed, you don't have hormonal problems or no problems related with your sexual desire. But during laparoscopic hysterectomy, if the ovaries are also removed, then you can have this small amount of sexual desire-related problems, and this can be overcome with hormonal treatments. Hysterectomy can be performed by different surgical techniques. There is the vaginal route of hysterectomy. There is open surgery, which is the removal of the uterus from the cut from the abdomen, or you can have laparoscopic surgery. The recovery is usually shorter and easier for the patient if it's performed by vaginal route or by laparoscopic way. When the patient has vaginal or laparoscopic surgery, the patient's hospitalization is like 1 day or 2 days maximum, and the patient is discharged and she will have a rest 1 to 2 weeks at home, and afterwards she can go on with her daily activities and she can start working after 6 weeks possibly. If it's an open surgery, these times might be longer for the patient, and the pain is usually much more if it's done with the open surgery. But if laparoscopic surgery or vaginal surgery for removal of the uterus, then the pain is really much less, and the patient is much comfortable at home. Whatever the way of removal of the uterus is performed, there can be a small amount of bleeding after the surgery, and we don't offer you to have sexual intercourse like 1 month after the surgery. You will be given prescribed some kind of antibiotics to keep you safe. You should finish the antibiotics and you will just see and check your incision area. If you have any problems, you should call your physician for these problems. And 1 week later, we just check the patient for any problems. And 1 month to 2 months later, you will revisit your doctor for any problems or to talk about the long-term issues.